Hello and welcome back to another new edition of Windows on Current Affairs, and today we talk about the government's exerted efforts to be able to contain the pandemic and also to stand up to the different challenges that are affected from the different strains and variants of the pandemic ever since it has started. And we're very delighted to be having with us our dear guest, Dr. Anan. He is a professor of pharmacoepidemiology, and he is going to be giving us quite a pack of very, very valuable tips about how could we be able to differentiate between different variants? How could we be able to protect ourselves and elderly citizens, and a lot more. Good evening, Dr. Anan. Let us first talk about the different variants, because we are completely confused. Too many variants.
Good evening, Ms. Dina. Thanks for having me. So if we are talking about variants in general, even if not specifically for COVID-19 disease, variants and the thing of changing the shape of a virus is something related to all viruses, not only for SARS-CoV-2 or what we are calling coronavirus. So we were not surprised that we do have a lot of variants. We started with a wild type, which is a prototype, the first type we've been facing since end of 2019, and then we got alpha, beta, gamma, delta, which was actually the most vicious variant from coronavirus.
Those were very recent.
Yes, it was the previous wave. And currently we do have the Omicron. And usually all viruses, they evolve and they mutate to be less vicious, but with more spreading power. And that's what we've witnessed with Omicron. We got a lot of studies talking about it's 3 times the spreading among population and the circulation of it, 3 times more than Delta. However, the good thing is we got less hospitalization rate from Omicron than Delta. So we have a lighter variant. That's a good news. And
which is the current one?
The current one, yes, the Omicron BA.1. That was in November 2021. Yes. And it was a good news because we do have a variant which is half the viciousness of Delta variant. Although it's spreading more, so we need to keep the same measures, because if we are talking about 2% of hospitalization, but we do have, for example, 1 million infection, we are now talking about 3 million infection from Omicron because it's spreading more. So we still have a lot of cases of hospitalization. We still have an ICU cases. So still, because most of the people are talking like, okay, COVID is over, we can now lift all measures, but actually not. It's not over. Still, we do have a lot of hospitalized cases. We still have mortality rates in Middle East and mortality rates, of course, worldwide. So in terms of variants, we do have a new variant just this month, which is a BA.2.
Just this
from
month?
Omicron, yes. And however, this is a subsidiary from Omicron BA.1. So it's not a new variant. It's a subsidiary one from BA.
It's a developed one.
Yes, exactly. It's spreading actually more than BA.1 Omicron. However, same viciousness. So we are not talking about a crisis or health crisis coming in the near future. Actually, WHO may announce this year the end of classification of COVID-19 as a pandemic, and just to classify it as a disease caused by a normal virus, same like influenza, for example.
Well, this is very important, and it's also at the same time very controversial. This means that it's not going to end too soon. It's going to continue with us for a few more years.
We can say that
Don't
COVID
tell us
will
that,
stay.
please. It's impossible.
But the classification will be different. We were classifying COVID as a pandemic, so it means it's crossing borders and the mortality rate is high. Since we do have now vaccines, we do have mortality rates less than 2 years ago because of the vaccines and because of Omicron variant is less vicious, we can reclassify COVID-19 as a normal disease. It's not a pandemic disease. So we still need to have a shot, a jab every year, like the flu jab, the influenza vaccine, but it will be every year just 1 shot or 2 shots based on the vaccine type, and that will be it. But it will stay for a couple of years. Of course, you cannot wake up in the morning one day in 2000.
Of course, not overnight, but at the same time, it has to end. I mean, it can be compared to flu because there are many people who have never ever had the flu jabs at all. I mean, it was not obligatory, but this one is obligatory. And there are lots of difference, and we do not see any sense in even comparison between the two strains or whatever. I don't know, what do you call it? However, we need to talk about the age range, because there are developing changes with the age range, and also the mortality rates, and at the same time the symptoms.
Yeah, actually it's a very good point, especially talking about influenza, the flu, and COVID. We cannot compare currently.
Let's do the comparison first.
Yes, once we reach a similar mortality rate from the flu and the COVID, we can consider COVID is not lethal or is not associated with high mortality rates.
Okay.
Then we can declassify as a normal disease. But of course, yes, in terms of obligation for taking the jabs, influenza jabs or the flu jabs were not obligatory for general public. However, it was obligatory in some countries for healthcare workers. So healthcare workers must every year take the influenza jab. I guess it will be like that in 2 years, for example. Healthcare workers, all people above 65, must have the COVID-19 vaccine every year, and I guess it will be optional in a couple of years for the rest of the population. In terms of age group, when we started with the Delta variant, we've witnessed infection among the young age, and we started to put young age and infants and adolescents as vulnerable groups, same as the adult population, and they need to take the jabs. One, to prevent their hospitalization or symptoms, and second, to prevent the spreading of the disease from the school-aged children or from the adolescents. That's why the mRNA vaccines like Pfizer and Moderna, they started to make studies to give jabs starting from 5 years old. And currently they are giving jabs from 5 years old in Middle East, in the States, and the EU as well. They approved it as well. So in terms of age, alhamdulillah, till now we don't have high hospitalization rate among children. We are talking about 0.1%, which is a very low percentage, and most of them are just moderate cases. They go to the hospital for 1 day and then discharge the next day. In terms of vulnerability of the rest of the general public, we still have the 3 categories of the vulnerable population. The above 65 years old, healthcare workers, and people with comorbid conditions. Comorbid conditions, we are talking like diabetes, we are talking like hypertension, or any chronic disease they are actually suffering from. In terms of whether the mortality rate is high or not, we can talk about the current wave currently in Egypt, for example. We are witnessing the peak of Omicron this month. We are facing very high cases.
Or March?
February is the peak. Inshallah, in the start of March, we will witness a plateau in terms of infection and in terms of mortality and deaths. And that's a very important point. Regardless, we have high cases or low cases, the most important item is to track mortality, to track how many deaths we are having every day. Because increasing the jabs, increasing the vaccination in Egypt will enhance or prevent the risk of hospitalization and deaths. Thus, we can have, for example, a very high infection rate, but decline in the mortality rate, which is the main objective of the vaccine. So starting March, we'll witness, inshallah, decline in the wave, the 5th wave.
So March is bringing us good news, but at the same time, infection might be a threat to people with chronic disease, and that's why that's what scares people. If people who are healthy people, they could be fighters, but people with chronic disease, like with heart problems and other chronic disease, or maybe some liver disease or something or whatever, they're prone to a lot of dangers.
Yeah, that's true actually. So That's why we were always saying that if you do have any chronic disease, you must be vaccinated. So vaccine is our first line and the only line actually currently for the chronic disease patients to be protected against hospitalization, especially diabetics. We've witnessed a lot of worsened cases for diabetics with COVID-19. So it's very crucial, even now with Omicron, to be vaccinated. Although we do have a lot of mild cases, we do have witnessing a lot of decline in mortality rates worldwide, but still we do have mortality, we do have hospitalization. Mainly most hospitalized cases currently from Omicron are people above 65 and with no prior vaccination and no record of any vaccination whatsoever. So the first line and what we can advise people, get vaccinated. You are protecting yourself from hospitalization, from death, and you are protecting others as well from getting infected.
That sounds good, but at the same time, we need to talk about the choice of vaccinations. I mean, are there, where we go to centers to get vaccinated, people who could be could you consult anyone there? And at the same time, the situation of the vaccination itself, we're talking about the elderly. If they are situated in a place where they could be carriers, or where there are people who could be infected, or they are situated in a place with carriers themselves, or prone to other disease, or very vulnerable to heart disease or things, or blood clots or something like that. How is it going to work with them? How do we regulate this problem? It's very complicated.
Okay, many questions are very important.
Yes, of course,
yes, so,
but that's the truth.
To start with the choice of vaccines. So in terms of choice, there is a protocol guidance in all the vaccination centers, and the physicians there, they decide as per the patient chart, which is, for example, age, history of any disease, history of having COVID before, although vaccinated, any comorbid conditions, and gender as well. Based on the chart, they actually select the proper vaccine for each case. But we can put some general rules. For example, if it's below 18 years old, we don't have any vaccine approved except Pfizer and Moderna. For example, patient with
below
history,
18.
Below 18.
Pfizer and Moderna, okay.
If we do have a female with a history of clots, we are not recommending, for example, vector vaccines. The vector vaccines are AstraZeneca, Johnson & Johnson, and Sputnik. These are the three called vector vaccines. And they are more recommended to males more than females with history of clots. If we are talking about patients, young patients, with history of cardiac problems, we are not recommending mRNA, which is Moderna and Pfizer, for example. So we do have some general rules, and of course we need to test for sensitivity towards any of the products involved in the manufacturing of the vaccine itself. And allergy or sensitivity is very easily detected inside the center itself.
Inside the center?
Yes. Usually we ask the subject or any person approaching the center whether he got any allergy or any sensitivity whatsoever from anything. If he got sensitivity from bananas, for example, from mango even, strawberries, it's a high risk that he can get allergy from vaccine. So they stay for 30 minutes inside the vaccination center to see whether they will develop any allergic reactions or anaphylactic reactions from the vaccine. 30 minutes or 1 hour is enough because it's an immediate reaction. If not, they will be actually sent home if they got a mild reaction. And we've witnessed a lot of mild reactions that can just go with anti-allergic pills. It's very easy to fade. That's for the selection setup. How can all people protect themselves? If they are not vaccinated, they need to get vaccinated. If not, for example, they are not eligible for vaccination. Some people cannot take the vaccine, whether because their body will not develop antibodies from the vaccine or they are contraindicated to take the vaccine. For them, there is a ready-made antibodies, which is manufactured by AstraZeneca as well. In Egypt, actually signed the contract to bring it to the protocol. The ready antibodies are actually given to people who cannot take the vaccine. It gives 6 months of protection, like a prophylactic, but it's a prophylactic drug, it's not a vaccine. It's a ready-made antibody. The vaccine will make your body make the antibodies, but the ready-made antibodies will just make your body flood with.
It's a little bit more mild.
Ready-made, yes, it's more mild.
But,
so that's if the subject cannot, or the person cannot take the vaccine. So if a senior citizen above 65 years vaccinated, how can he protect or she protect herself? It's again very easy. We need to return back to the measures, the social distancing, the masks in terms of crowded places, or the family gatherings. I know it's very hard in family gatherings to tell our family to wear masks, but at least if we are all a bubble of vaccinated family, it's very hard to transmit infection. If I'm vaccinated, you're vaccinated, the chance of transmitting the virus will be like around 10 to 12% only. So we do have a very low probability to transmit the virus. So bubbling, it means having all of us having the vaccine, or all of us are doing rapid test or PCR to make sure that we are inside a bubble, and inside the bubble we are all vaccinated, so we are free of vaccine, free of disease.
But we did not talk about the choice of vaccination type of jab for the elderly with chronic disease, like with heart attacks, with blood clots, with.
So again, the same rule will apply. So if we are talking about female above 65 with history of clots, we are not recommending vector vaccines. If we are talking, for example, a male with history of cardiac problems, sometimes we are not recommending, based on the profile, of course, sometimes it can be useful, sometimes not. We are not recommending mRNA. But usually above 65, the side effects of vaccines are very minimal. Most of the side effects were with subjects or people under 40 years old, because the immunity is very active, so the person can experience high side effects from the vaccine. Above 40, it's very rare to have any side effects from the vaccine. Above 65, it's very rare to see in the studies from any vaccine we are seeing an adverse event. Very minimal. It's 1 day.
No side effects, so it's safe.
It's only the normal side effects, which is high blood pressure, just feeling weak for a day or two, fatigue, and so on. Which is the reaction of our immunity system. It's not from the jab itself. Some sensitivity sometimes at the site of injection, and that's it. It will go in 1 or 2 days.
But what is recommended? What type of vaccine is recommended?
As I told you, above 65, everything will be safe. It's just according to some sub-disease profiles that we can recommend one over another. But all of them are safe. We are talking about inactivated vaccines like Sinopharm, Sinovac. They are pretty safe. It's the safest ones. We are talking mRNA, Pfizer and Moderna, and the vector vaccines. All of them above 65 are pretty safe. It's very minimal when a physician, for example, say, okay, for this profile in particular, it's very vulnerable. We are not recommending any vaccine except Sinopharm, for example, because we are not putting ourselves in a place when we can have 1 or 2 days of side effects. Sometimes it happens, but who can decide that? True. The only person who can decide that is a physician sitting in the vaccination center, or the treating physician.
Or the physician of the person.
Yes, the treating physician.
But can I take it the other way around? Can we take it, I mean, to avoid all the complications, I mean, below the 65, could I just pick up the Sinopharm next time and I get vaccinated just to, you know, keep away from the hassle of the complications and side effects?
Yeah, any vaccine will do.
Sinopharm would be okay for young people?
Young, still the studies are not finished. So far, we do have only Pfizer and Moderna below 18. But in general, from 18 to 65 as well, any vaccine will do. The thing about vaccines, we are talking about protection from mild conditions. So vaccine will protect from mild conditions or symptoms, protect from hospitalization, and protect from death. If we are talking about mild symptoms, here we have a lot of differentiating points between vaccines. For example, highest protection is among mRNA, Pfizer and Moderna, from mild.
Highest protection?
Highest protection. We are talking how much?
Not AstraZeneca?
30%.
Not AstraZeneca, I mean, all of us.
From mild All of them are very weak. Currently, against Omicron, we're not having or witnessing any high percentage of protection. That's why we are seeing people with vaccine and get infected and reinfected even with vaccine.
Exactly.
So that's why the protection versus Omicron from mild condition is only 30%. That's it.
So only it's providing us with 30%?
Yes, but that's for mild. The most important is protecting from hospitalization.
Okay, and the severe
protecting
one.
from death. Protecting from hospitalization, we are talking about protection. People vaccinated are less chance of being hospitalized with 65%.
All age.
All age range, exactly.
Of age range.
When you go up, the risk will be higher. When you go down with less comorbidities, the risk will be less. And the third one is preventing mortality or preventing from death, protection from death. All vaccines are almost the same. It's above 90%. That's why I'm saying that all vaccines are the same in terms of preventing mortality and hospitalization to some extent, which is very important to consider. However, if we're talking mild symptoms, mainly all of us got Omicron, vaccinated or not, but the vaccinated people got Omicron milder. And the most important is the long COVID. Long COVID is post-COVID
let's
syndrome.
talk about the long COVID.
Yeah.
The long COVID and the post syndromes, which are very, very common between people.
Yeah,
even people, they don't know if they're really diagnosed by those syndromes or no. And you don't know whom to ask. And what are the diagnoses, and what do you feel, and all that. People would need a lot of awareness about these particular cases.
Yes, because we've witnessed a lot of panic post-Omicron, specifically post-Omicron, because people are suffering from neuritis, for example. They feel pain in extremities, in their limbs and so on. And they feel like they are very tired and fatigued all the time. And we call it chronic fatigue syndrome. And they suffer from sometimes headache.
Dizziness?
Yes, dizzy. Sometimes their memory are not saving them all the time. They are not fast remembering. So all of these symptoms are called the long COVID or a post-COVID syndrome. We do have in many countries what we call a post-COVID clinic. We don't have it in Egypt, but in UK, for example, the post-COVID clinic usually work with people post-Omicron to start with very simple treatment, which is walk every day as much as possible, even if you are tired, very tired. Try to walk. If you can reach jogging or walking for 30 minutes every day, it will be perfect, because in 1 week or 10 days you can restore your normal energy level.
By walking?
By walking.
By walking is very exhausting.
Yeah, and the first day it will be 5 minutes. Second day, 5 minutes. Third day, 10 minutes. And then increasing. Don't pressure yourself, but don't let yourself to the laziness feeling, because once you let yourself do the chronic fatigue syndrome, you will be more fatigued. You will get more fatigue. It's not going to be easy to get from the low energy status to a high energy status later on. The sooner the better. Once you get rid of the laziness effect of the chronic fatigue syndrome, it will be easier. Second one is to hydrate. Drink as much water and fluids as possible. We're talking, I know it's winter and most people forget to drink, but it's very important to drink water, 4 liters even per day. It's very beneficial with the long COVID. And for the neuritis, for the headache, they can take a symptomatic treatment. For example, people are advising with vitamin B for the neuritis. And don't get panic, because people are getting panic all the time from the
people are very friendly and familiar with all types of pandemics, but at the same time, people also, they need to know. Most of us don't really know about the new protocol with Omicron. You know, we've been there for a long time, and too many strains, too many variants. We don't know if are we going to take I mean, I'm not going to say names of treatments, but at the same time, is it going to be the same medicine, the same detergents we're going to be taking it, or different ones?
Yeah, it's a good point. We do have a lot of new medications in the protocol in 2022. Of course, in COVID, we are treating symptoms. So, for example, to start
not
with,
like the first one.
not like the first one.
Not a fixed protocol.
Not a fixed protocol. So, for example, and a very important point, do not copy-paste protocols. If
Really?
if you have an Omicron, don't just ask a friend and copy-paste the protocol.
People do that all the time
All
now,
the time.
to be honest
Yes.
with you.
And taking prescription online, from Facebook and so on, it's completely wrong. We need to treat symptoms. For example, if a person with cough, is it dry? Is it a productive cough? For example, is there a chest pain? No chest pain. There is a history of clots, no history of clots. There is diabetes, no diabetes. So each person got specific protocol that must be personalized to his state. We cannot copy-paste protocol. And mainly, for example, we can just treat the mild symptoms and the mild COVID of Omicron with just paracetamol and some painkillers if it's a very mild one. We can add cough syrups.
Vitamin
and
C
that's
is
it.
also
Vitamin C as well.
good.
Eating fruits, sitting in the sun, getting a lot of fresh air every day, that will be enough. No need to take, for example, 15 medications and the person is just only with a normal, very mild symptoms.
And no drugs of immunity and all that like before?
We are not needing that for mild conditions. And as I was telling you, we need to personalize it. If it's a moderate one, we need to increase the medications. However, if it's a moderate to severe one or critical, currently we do have a lot of new medications. Egypt contracted monoclonal antibodies, which is taken for moderate conditions to prevent hospitalization. So it's given to people with comorbidities with mild conditions that can evolve to be moderate to critical. We got as well new antiviral medications. Currently, Egypt will manufacture locally Monopravir. Monopravir is an antivirus specifically for COVID, and it prevents as well the hospitalization with more than 80%. So it's taken at the first 3 days of infection for people with vulnerable conditions, comorbid conditions and so. So with the latest protocols, with the latest antiviral medications, we do have a robust protocol. That's why we do have less hospitalization worldwide, and that's what encouraged the international organizations that maybe this year we can announce end of the pandemic and just reclassifying COVID-19.
Well, that sounds great, but it sounds like this particular drug that you're talking about, the pills.
The Monopravir, yeah.
You're right. It's going to be like the cold and flu medicine in the near future. I mean, we're going to be using it just like that.
Yeah, but it got a higher side effect to be used on a regular basis. All the antivirals got a lot of side effects. That's why it will be indicated only for people with mild symptoms currently, but with comorbid conditions or chronic diseases, and we are afraid they can evolve and enter hospital because of their condition.
So it's only for a specific category of people.
Exactly, yes.
Right. To be honestly speaking, do you think it's going to take its place for more like 4 or 5 years, or it's on a decline? I mean, because it's evolving every 2 months.
As a pandemic or as a disease? As a pandemic, I'm optimistic that this year we can reclassify COVID-19 and just remove the pandemic label. As a disease, we're still facing a lot of waves. Hopefully it will be mild waves. All the population around the world will be vaccinated, but we are faced actually with something more than the disease itself. The vaccine nationalism, the politics behind the COVID, because we don't have a fair distribution of vaccines worldwide. In the States and EU, they are storing vaccines, and we are lacking vaccines in Africa. We are lacking vaccines in South America. And that's why, for example, Omicron evolved, because of the lack of fair distribution. So,
do you think it's because of the vaccines or because of the lack of enough awareness amongst people, even the rich people and the educated and the people who have the vaccine?
Yes, and I can add to this list.
We need awareness.
Selfishness.
And selfishness.
Yes. So,
and carelessness.
For example, by the end of 2021, there were 8 billion jabs distributed and manufactured. 8 billion jabs. If they were fairly and equitably distributed, we are talking about more than 4 billion persons to take the vaccine. If so, it would have ended by the mid of 2021.
So what happened?
They stored the vaccines. Europe started to give third shot, same for US. So they consumed all of these billions of doses for their people who were actually vaccinated, and they deprivated the African population, and most of the African countries got less than 3% inoculation and vaccination rates. And that's why we had most of the variants are coming from Africa. So if we are reconsidering equitable distribution, if we are putting in place all the knowledge transfer and technology transfer of medications and vaccines, so middle income country can remanufacture like Egypt is doing currently, manufacturing the protocol, manufacture the vaccine and distribute in Africa, I guess with optimism, inshallah, we can end the classification this year.
Hopefully. We don't have anything unless that we have to cross our fingers and pray that in the near future, every day there is something new. And God only knows, maybe we could find a solution or a way out of that in the very near future. People are working very hard.
Yeah, especially that the economy is actually harming a lot from the pandemic, and especially in Europe, because they got a total lockdown. They are faced with a huge decline in the gross domestic product, the GDP, from the closure. And that's why Europe was the first continent to lift all the measures from COVID-19, because they cannot continue with the pressure of the public and the pressure of the economy on having a total lockdown again. And we were lucky, and we were actually, I can say, clever when we've made the closure or the lockdown just a semi-one for one wave, because we've faced the COVID first wave and second wave with mild economic problems. But for example, we had a growth in 2021 in Egypt, we had a growth in 2022. It was actually great for our economy. However, still our vision and mission that we've put before COVID, we didn't achieve because of COVID as the rest of the countries. So all of the continents and all of the countries, they want to lift all measures as soon as possible. But this will never going to be achieved with selfishness or with vaccine nationalism, which is storing vaccines for their individuals and their population only. And for example, to prevent the technology transfer, the patency of the vaccine, WHO and all of international organizations are actually talking about you need to drop the patency from vaccines, because that's a global crisis. We can get from this crisis together, or we're never going to be getting out of this crisis.
Exactly.
Yes.
They need to understand that. The superpower countries need to understand that before developing countries.
Exactly. Yes.
That is the problem. It seems that we need another episode. I'm so sorry because we ran out of time, but it seems we need like dozens and dozens of hours to be able to, in order to spread awareness concerning that particular problem, because half of the solution is in awareness and, like you said, the justice or regarding the spread of the jabs and everything. Dr. Islam Anan, you are a lecturer of pharma entomology. Would like to thank you so much and wish you all the best with your researches and everything. Hopefully that you could hear some good news in the near future.
Inshallah. Thank you. Thank you.
Thank you so much. And I guess that would bring us to the end of this edition of Windows and Current Affairs. Many thanks to all of you. Until we see you again next week, that's a goodbye.